A big hello to all. This is on public demand. It was long time pending. I've been getting so many requests to make an awareness video regarding the do's and don'ts of polycystic ovarian syndrome, and I finally found out time to make a video for it, for the general public, for the patients, for so many women organizations or a few companies that the demand was there to talk about polycystic ovarian syndrome. I think PCO, PCOS, PCOD, these terms are so common, and you find every other girl who walks into your OPD or meets you or tries to question you something that, oh madam, I have PCOS, I've been diagnosed with it and I'm not getting treated. Again, it comes back. And what do I do about it? So first and foremost, what I think is, if you go by the epidemiology and other things, the statistics, maximum 20 to 30% of reproductive age group, I don't consider it that. And that's just the tip of the iceberg. With the present lifestyle of people and all that, there is a huge iceberg down under the water. People come to us only when they're suffering from infertility or some menstrual irregularities, or when there's a big low self-esteem due to the skin changes or acne or something. So when it goes up to that level, they come and address the situation and get diagnosed as PCOS. On the contrary, it's a huge overdiagnosis. I think every other clinic or they go to, oh, you must be having PCOS, even a GP or a general practitioner says, or anyone says. I think that should be stopped. It should not be underdiagnosed. It should not be overdiagnosed. That's what, that is the first thing that I would like to tell all the healthcare providers or the patients or the women who are seeking help and they're diagnosing themselves, self-diagnosis, or hearing from their friends or relative, oh, I have PCOS and this and that. I think that has to stop first. PCOS has a few symptoms. Everybody is aware about it from the net, from so many other things, from the doctor. Whether there are skin changes, acne, or there's hair problems, hair loss, or male pattern baldness that we talk about, or there's darkening of the skin, or we call it acanthosis nigricans in our language. So I think these are the few things that women are very concerned about cosmetologically or for their self-esteem, because all women want to look pretty in this world. So it's not about just looking pretty, it's about to feel good inside, feel healthy inside, and automatically that appears on everything externally. The second thing is, of course, our menstrual irregularities. Every irregular menstrual cycle or amenorrhea or oligomenorrhea cycles is not PCOS. Again, you need to diagnose yourself that what is the real issue for your abnormal uterine bleeding or your menstrual irregularity. Third thing is what's your weight, whether you are a thin person, a normal weight person, or an overweight, obese person, because even thin people, normal weight people also can have PCOS. That has to come out of the mind of so many women and girls. That is a misconception they have. What we call it a lean PCOS, and it becomes even more difficult to treat them, whether it is from the reproductive point of view or anything. But again, the answer to all of this, before going to the second line, that is the drugs and all that, the first line, the do's and don'ts, remain the same for all the kinds of weight of people, for all the age groups, for all the problems they're dealing with, whether it is your skin, your hair, your menses, or your reproductive health, or your problem in conceiving, or any other issue related to PCOS which is existing, whether only the cholesterols are high, the sugars are high, or it is a mixture of all of them. So first you need to understand, why do we call it a PCOS? I don't like the term PCOD. I don't like to address it as a disease. It's a lifestyle disorder. So syndrome is lot of symptoms coming together. We call it a syndrome. Some may have a few symptoms, some may not have it. So when you're finding all of these issues into you are finally diagnosed correctly and rightfully as PCOS. You need to know what you have to do. If you're not having skin changes, well and good. If you're not having hair problems, well and good. If your menses are bang on, well and good. But there are a few other things also you need to see. Some may be having dyslipidemia, some may be having cholesterol issues, some may not be having. But you need to keep in your mind that may be developing a lot of changes later on. Your cholesterols may be affected, your insulin may go up and down, insulin sensitivity in the body, you may be prone for diabetes and other things. A lot of the lifestyle disorders, the genetic disorders, they come from the forefathers, from your maternal side of it, which has more predisposition in this case. That is why we find so many sisters and the relatives having the similar symptoms, or the mothers having the same symptom. Now comes the why is the present generation suffering so much, why the earlier generation didn't suffer that much. That is where comes the do's and don'ts. So all the answer to that is what kind of lifestyle people are having, what they used to have earlier. So we all, or in general, the public has a lot of excuses about the lifestyle. We find our patients, so many patients coming and telling their sleep is not okay, their food is not okay. So many issues are there, which is correct. So they need to know what are the do's and don'ts. Me just telling the ideal things doesn't work. They have to implement it. So a beautiful line that we have, the genes are loaded in the gun. Lifestyle is the trigger. That is the answer to all the lifestyle disorders, whether it is PCOS or anything else, because we need to defeat PCOS and not let PCOS defeat us. So the do's and don'ts, I would just like to summarize it in 5 words, because this video cannot tell it what to do, what not to do. Exercise is the answer for any kind of weight, even if it's a thin woman. So as exercise, the number of minutes and hours depends upon you, the intensity depends upon you, how much you do it. Lifestyle does not only include exercise, it is the food you eat, because in present generation we know the number of adulterants, additives, preservatives and the hormones being given in different kinds of food items which are affecting the hormonal milieu in the body. That is also there. So we need to watch what we are eating, because we cannot bring the previous era back in which things were pure, the environment was pure, the stress was less, and the world was a different place altogether, with people having different kinds of jobs and all that. Because any kind of job you do, whether it's your sitting job, work from home, IT professionals working in any other setup, marketing, doctors, engineers, every profession has its issues, disadvantages, stress, but we cannot let the work affect the health. So that is something that the working professionals need to understand. Even the people in the other age group, I find the students or the younger age group having more issues, more stress in their life regarding their studies and other things, because we see adolescent age group people, they also have a huge issue and they're under stress. I think that is upon them, that how much yoga, meditation or various other recreational activities or hobbies they can adopt to reduce the stress in life. Have a good proper sleep of 7 to 9 hours at least in a day. The amount of hydration they're maintaining, 2 to 3 liters on an average, but that again depends upon our weight, the kind of food items they're having, to increase more high fiber diets and reduce refined diets or processed food or fast food or junk food, and even reduce a lot of sugar in the diet. I think because we know that cholesterol and sugar is the most affected thing when it comes to this, and also to keep the weight in check if they're on the higher side of the BMI or they're overweight or obese. But same kind of exercise, same kind of diet and lifestyle, and taking care of mental health applies to the thin PCOS patients also. So diagnose yourself, do not overdiagnose, underdiagnose PCOS, exercise, maintain a healthy lifestyle, eat proper kinds of food, try to restrict as much as you can. It becomes very difficult for everybody in the world. These are ideal things, but it again depends on you. So the drugs and other things come on the later side, how we are going to manage it. And of course, if there is any other thing involved with it, your healthcare provider is definitely going to help you out. So take care of that. Take care of a lot of issues if there is there on your face, on your skin and all that. It can be a team of professionals along with your gynecologist. You can also consult your dermatologist to help you about it. So your hormones coming into control, your skin being taken care of. So there are many things that can be done, because quality of life is very, very important. It matters how you deal your life every day. What are the things that you have to correct yourself, how you're going to eat, how you're going to sleep, how you're going to enjoy life, and how you're going to be happy, and how you're going to find satisfaction in your work and otherwise. So it's very, very important. Something that PCOS has, that is mental health. Again, because of the influence of the hormones, there may be low self-esteem, anxiety, depression, a lot of issues, psychosomatic things that can come up. Again, they can seek the help. The most important help is exercise. Of course, it can help you. These are the simple things that we can see. We are not going to the second, third line and the other things that we can seek for people. So I think that is all that I would like to tell in the first video, because there's a lot more to talk about PCOS in detail and it is not possible in a video. That's why I had been stalling it for a long time, that what do I say about PCOS? It's huge and I can't get into the genetics, epigenetics, pre-genetics and the various treatment aspect of it, and people are going to be scared about sugar, cholesterol and other things, but they really need to know what it is. Come and seek help from his healthcare provider. Be healthy, be happy and have a wonderful quality of life and defeat PCOS. Don't let it defeat you. Thank you.